Now what we will discuss is syphilis. Syphilis. This is a very important sexually transmitted infection. The causative organism is Treponema pallidum. Treponema pallidum. The incubation period is, it's a wide incubation period, 9 to 90 days. What are the stages of syphilis? After someone getting infected by the bacteria Treponema pallidum, there will be genital ulcer. That is the primary stage. After that, the ulcer get healed and there will be appearance of some other skin lesions, that is secondary stage. After that, patient will move on to the latent phase. Okay, the latent stage has two parts, early and late. It is presumed that early latent stage persists for 2 years. Then it moves on to the late latent stage. In late latent stage, the patient may develop tertiary syphilis. Okay, so as it is a sexually transmitted infection, I have already mentioned the route of transmission is by sexual intercourse, and also it is get transmitted by blood transfusion. Now first we will discuss the primary stage. The first lesion of primary stage is a papule, a transient papule which will produce genital ulcer. Okay, the genital ulcer is single in number, non-tender. It is not painful. Induration is present. It is indurated. Okay, base is clean and it doesn't bleed on touch. Okay, so this is the features, these are the characteristic features of genital ulcer of primary syphilis, and this is known as hard chancre. This is the picture of hard chancre. See the single lesion having a clean base. Okay, this is primary chancre or hard chancre of syphilis. Okay, there is involvement of inguinal lymph nodes. There is bilateral inguinal lymph node enlargement. Lymph nodes are non-tender and the feel is shorty or rubbery feel. Shorty or rubbery feel. Okay, now what is the investigation of choice for primary syphilis? Investigation of choice for primary syphilis is dark ground microscopy. Dark ground microscopy is the investigation of choice for primary syphilis, and we see the spiral organism. We see the spiral organism in a dark background. Okay. So after that, the primary chancre heals. And if the patient doesn't get any treatment, then he will enter in the secondary stage. Okay, secondary syphilis, due to hematogenous spread of the bacteria. Hematogenous spread of the bacteria. Okay, it is a systemic disease. Secondary syphilis is a systemic disease. There will be some constitutional symptoms like fever, joint pain. There will be generalized lymphadenopathy. The characteristic lymph node that is enlarged in secondary syphilis is epitrochlear lymph node. Epitrochlear lymph node enlargement is characteristic of secondary syphilis. Okay. Next, about the skin lesion. Skin lesion of secondary syphilis. We can see all the types of primary lesion, primary skin lesion in secondary syphilis. Polymorphic skin lesions, okay, except vesicle. Vesicle is not seen in secondary syphilis. Now, what are the characteristic features of skin lesions of secondary syphilis? They are symmetric in nature. They are asymptomatic. They are asymptomatic. Palms and soles are involved. Palms and soles are involved. See the lesion of secondary syphilis over palm, and if we press the lesion over palm with a blunt end of a pin, if we press it with the blunt end of a pin, then there will be deep dermal tenderness. This is known as Buschke-Ollendorff sign. Buschke-Ollendorff sign, very important sign of secondary syphilis. Next, lesion over the genitalia in secondary syphilis is condyloma lata. Condyloma lata. See the difference between condyloma lata and condyloma acuminata. Here you will get flat surface. The surface is flat of the lesion. Okay. The genital mucosa is involved and the lesion is flat. The surface is flat. Okay. Whereas in condyloma acuminata you will get projected surface. Okay. Finger-like projection is there, hence the name acuminata. Okay. Next, in the oral cavity you will get snail track ulcer. Snail track ulcer. Okay. Next, this is the snail track ulcer of oral mucosa. Okay. Here there is patchy non-scarring alopecia. Patchy non-scarring alopecia. It is known as moth-eaten alopecia. Okay. Okay. Now, what is the investigation of choice for secondary syphilis? Investigation of choice for secondary syphilis is VDRL. Okay. VDRL in serial titer is obtained for secondary syphilis. Now, there is an entity known as Syphilis D-omle. Syphilis D-omle. What is this? This is secondary syphilis following blood transfusion. Secondary syphilis following blood transfusion. Okay. As it is directly enter in the bloodstream, so there is no primary stage. No primary stage here. The hematogenous spread occurs de novo. Okay. Next is latent syphilis. Latent syphilis is of two types. Okay. Conventionally, within 2 years, this is early latent syphilis. Early latent syphilis is infectious. And late latent syphilis, this is non-infectious. There will be no clinical feature. In latent phase, there will be no clinical feature. What you will get only positive serology. Only positive serology is there. Okay. So, investigation of choice for latent syphilis is enzyme immunoassay. Enzyme immunoassay. Okay. Next, tertiary syphilis. If the patient even not get treated in the latent phase, then there is a chance of progression to tertiary syphilis. What we get in tertiary stage is a nodule which will rupture to produce punched out ulcer. Punched out ulcer. Okay. This is known as syphilitic gamma. Syphilitic gamma. In the base, there will be wash leather slough. So, in the primary chancre, the base is clear. But in the tertiary stage, when we get the syphilitic gamma, then the base is not clear. There will be wash leather slough. Okay. Tertiary syphilis is also a systemic disease, and if there is cardiovascular involvement, it is in the form of aortic aneurysm, aortic regurgitation. Okay. Now, the most common site of aortic aneurysm is ascending aorta. Okay. Next, if there is neurological involvement, it is of two types. First is Generalized paralysis of insane. Generalized paralysis of insane. And second is tabes dorsalis. There is gait instability in tabes dorsalis. What is the investigation of choice for neurosyphilis? We do CSF VDRL. Okay. Next, relapsing stage. Relapsing stage. Okay. After appearance of primary chancre, there is a chance of relapse. Okay. So, if relapse occur in the early stage, then it is called chancre redux. That is appearance of chancre over the site of previous lesion of heart chancre. Next, if it is late relapse, so chancre redux is basically chancre developing over a lesion of previous affection. Late relapse, here we get, what we get is gamma. Syphilitic gamma appears over the site of previous chancre. Okay, so this is known as pseudo chancre redux. Basically, due to this is not a chancre, this is basically gamma, hence the name is pseudo chancre redux. Okay, next, what is the treatment of syphilis? We all know the treatment. Yes, it is injection benzathine penicillin. We all know the dose also. We give 2.4 million units. Deep intramuscular injection is given. It is equally divided and given in each buttock. Okay. Now, for early syphilis, a single intramuscular dose is sufficient. Okay. For late syphilis, 3 doses are given. 3 doses are given weekly, once weekly for 3 weeks. Okay. Next, if it is a case of neurosyphilis, then the drug of choice is injection aqueous crystalline penicillin. Okay, it is given IV, intravenous, for 10 to 14 days. Okay, next, those who are allergic to penicillin. See, penicillin is the drug of choice for syphilis until and unless patient is allergic to it. If the patient is allergic to penicillin, then what we give is doxycycline. 100 milligram doxycycline is given twice daily for 2 weeks in case of early syphilis, for 4 weeks in case of late syphilis. in pregnant patient who are allergic. Pregnant patient if allergic to penicillin, then what is the drug of choice? No, it is not erythromycin. It is also penicillin. We give penicillin. We give penicillin after desensitization. Desensitization. That is very small amount of small doses are given again and again repeatedly, so that there will be desensitization from the penicillin allergy. Then we give the full dose of penicillin in pregnant patient. Okay, next very important thing is the congenital syphilis. It is very important for MCQ purpose because there are many named signs in congenital syphilis. You have to mug up the names also. Okay, so congenital syphilis, the fetus get infected in utero and it get birth with some features and develop some features after few days. Okay, so there are two stages of congenital syphilis, early and late. Early congenital syphilis present within 2 years of life. Within 2 years of life. And late congenital syphilis present after 2 years. Okay. Okay. So what are the features of early congenital syphilis? The baby will have rhinitis or snuffles. Okay, there will be hepatosplenomegaly. Okay, next is vesicobulous lesion. Vesicobulous lesion over palm and soles. See one thing, as we have discussed, in primary syphilis there is genital ulcer. Okay, so in congenital syphilis there is no history of genital ulcer. So what we get in the early stage of congenital syphilis is basically secondary stage. Okay, but here we get vesicobulous lesion. So this is an exception of the lesion in secondary stage. We don't get any vesicular lesion in adult secondary stage syphilis, but we get vesicobulous lesion in congenital syphilis. Okay, next one named sign here is Wimberger sign. This is the image. Wimberger sign. What is that? Wimberger sign. Okay, there is erosion, bilateral erosion over the medial aspect of upper tibia. Over the medial aspect of upper tibia, upper part of tibia. Okay, it is clearly visible here. See the eroded part of the medial aspect of upper part of tibia. This is Wimberger sign. Okay. Okay. Next we will see the late stage, late congenital syphilis. Okay, there is one important named sign that you have to remember, that is called Hutchinson triad. Hutchinson triad. Okay, what are the components of the triad? We get Hutchinson teeth. Hutchinson teeth. Okay, there is notched upper central incisors. Okay, notched upper central incisors. This is known as Hutchinson teeth. This is one. Second is the eye feature, interstitial keratitis. Third, sensory neural deafness. Okay, so these three are the features of Hutchinson triad. Okay, next, what are the other features? You will get saddle nose, similar to leprosy. You will get saddle nose here also. Another important is mulberry molars, the cusps of molar tooth. Okay, next, there are important osteological changes in the form of periosteitis. Okay, depending on the involvement of the site, they have individual name. Okay, if it affects the frontal bone, then the name is Olympian brow. Olympian brow. Next, second, if it affects the sternal end of clavicle, then the name is Higumenaki sign. Higumenaki sign. Sternal end of clavicle. Next, third, if it affects the anterior surface of tibia, then the name is Schaber tibia or Schabersin. Okay, Schabersin or Schaber tibia. Okay, so these are the important osteological changes. Next, investigation of choice for congenital syphilis is also very rare. Okay, so these are important. Learn every named features of congenital syphilis and all the stages of acquired syphilis in details. Okay.